Mechanism of antiemetic drugs. Antiemetic drugs are medications designed to prevent or alleviate nausea and vomiting. The mechanisms of action can vary based on their specific targets. Here are some common classes of antiemetic drugs and their respective mechanisms. 1. Anticholinergics. Example, scopolamine. Mechanism: scopolamine blocks acetylcholine receptors, exerting an antiemetic effect by reducing cholinergic input to the vomiting center. It is often used in the prevention of motion sickness. 2. Histamine, H1, receptor antagonists. Examples, dimenhydrinate, diphenhydramine. Mechanism: these drugs block histamine H1 receptors in the vestibular system, which plays a role in motion sickness. By inhibiting histamine signaling, they reduce the input that leads to nausea and vomiting. 3. Serotonin, 5-HT3, receptor antagonists. Examples, ondansetron, granisterone, palonosterone. Mechanism: these drugs block serotonin, 5-HT3, receptors, particularly in the gastrointestinal tract and the chemoreceptor trigger zone, CTZ, in the brain. By inhibiting serotonin signaling, they reduce the sensitivity of the vomiting reflex. 4. Dopamine receptor antagonists. Examples, metoclopramide, prochlorperazine, promethazine. Mechanism: these drugs block dopamine receptors, particularly D2 receptors in the CTZ. By inhibiting dopamine signaling, they reduce the sensitivity of the CTZ to stimuli that can trigger nausea and vomiting. 5. NK1 receptor antagonists. Example, aprepitant. Mechanism: aprepitant blocks substance P, a neurotransmitter involved in nausea and vomiting, from binding to neurokinin 1, NK1, receptors in the CTZ. This helps prevent and control chemotherapy-induced and postoperative nausea and vomiting. 6. Cannabinoids. Example, dronabinol. Mechanism: cannabinoid receptors, particularly S1 receptors, are found in the central nervous system, including the vomiting center. Activation of these receptors by cannabinoids can reduce nausea and vomiting. 7. Benzodiazepines. Example, lorazepam. Mechanism: benzodiazepines act on the central nervous system and may help control nausea and vomiting by exerting anxiolytic and sedative effects. Disclaimer: this channel does not promote or encourage any illegal activities, and all contents provided by this channel are meant for educational purposes only. Any copyrighted material on these slides is included as fair use for educational purposes only. It will be removed at the request of copyright owners.